didn't take out the gloves.
Yeah.
I didn't take out the gloves when I was done. And he was like, after bimanual examination, you just kept the glove on.
And I still had other stations to do, so I was worried that it will affect my momentum, like going through the rest. I should have been calm and relaxed, and I wasn't. So because of that, I forgot some of the important things I was supposed to.
Want to follow me? Come to Tamale Teaching Hospital.
What is that? Today, the medical students for University for Development Studies level 400 completed their final exams. So I'm here to ask them certain questions about their experience in medical school. Hello, good morning.
Good morning.
Please, may we know your name?
So I'm Prince.
Prince. So today's question is simple. What is the most unexpected or the weirdest OSCE experience you have ever had in medical school?
Okay. Year 2 OSCE.
Continue.
My last station before I had to leave, I entered the room. Prof. Jen was sitting there, and I could see a female torso. Obviously, it's either you are doing a gravid exam or bimanual examination. The question was bimanual examination. So but I was confident. I had learned the thing. I passed like upon that too. Very nice. Wow. And I started my exam, did all my rapport seeking, washed my hands, everything, wore my gloves. And I did everything, and I was done. When I was done, the man was looking at me with such a countenance and made me look like I did something very stupid. And I didn't know what I did because I was very confident of what I've done. Then he was like, "Are you done?" I was like, "Yes, sir, I'm done." Like, "Did you greet your patient?" I was, "Yes, I greeted my patient." And then he came again. "Okay, what if your patient wants you to shake him?" And I was
Your patient wants to
like shake his hands as a form of greeting him. And I was, "Oh, why not?" And I extended my hands to shake him. No, he said, "I didn't take out the gloves."
yeah.
I didn't take out the gloves when I was done. And he was like, after bimanual examination, you just kept the glove on. And the funny thing is that when I was done and then he was asking follow-up questions, the glove was on me and I was scratching my hair, touching my earlobes and things. And I was like, once you have some funny accents, when you grow up, this is what you're going to do in your hospital. He made me sound so stupid, but I was confident I'd done everything. But that's very little blunder, no. Spots everything for me. I think for me, that's one of my worst experiences. I've done everything I could do, but then just one mistake made me look so foolish in front of the examiner.
I'm very sorry and I apologize.
What was going through your mind at that particular point when he told you realized the gloves was on your hand?
Oh, that thing, to err is human though, but then I couldn't believe myself though. I don't know what could have happened during that time, but then I had done what I could do. The funny thing is that when he was looking at me, I think he was trying to give me a cue to take it off or something, but to me, I have done what I could do. That's why I couldn't get it. But then not, or show me some weird way. But I did what I could do.
What did you learn from that?
What did I learn from that is, well, first of all, I learned something very nice, very important, that in the OSCE exam, even as you are engaging in the exam, even as you are being asked questions, you're also learning as well. You see, there's something they tell us that do not be arrogant and then never, ever, ever fight. Never ever fight with the examiner there. I think if I had done that, I'd be like, there's nothing wrong. I did everything perfectly. I think then he'd have even dismissed what I'd done from the start, or I would have failed that particular exam. But then I accepted, even though I was confident, I had done what I could do. And I think that's one thing I learned.
Okay, thank you, Prince, for having time with us. Have a nice day. Bye bye. Hello, welcome to Medical Mind.
Thank you.
Please, what's your name?
I'm Saddest.
Okay, so Desmond, you have to share one of your unexpected OSCE experience or the saddest one.
Oh, okay. So I remember that one will be in level 100. When you're supposed to do something for the first time.
So is that true? No. So is that true? I said no.
So it was my last but one station. So I entered and I saw this beautiful woman sitting there. So my first impression was I have to greet the woman. So I greeted her, "Good morning, madam." Not knowing he didn't take that personal, because I didn't know he was a doctor and she find it offensive me calling her madam. So he didn't actually talk, he just nodded and showed me what to do. So I started with what I'm supposed to do. The question there was some form of, it should be a conversative between me and then the madam or the one over there.
This grammar now, wow.
But because of, I say, the first impression I made, he actually wasn't in that zone with me. So he started, giving me some odd expression. So when the bell rang and he started asking me questions, so why am I calling him madam? Do I know her? And I said, I don't know her. Not knowing he was our preclinical OSCE coordinator.
Then you've not been going.
And so that was what he said. And I said, oh, me, I've been coming every day. He was like, if I don't know her, then it means I've not been coming. Whatever I said didn't solve the problem. So he made us go forth and back until the bell rang for us to complete. And when the bell rang, you have to stop everything you're doing. Then I have to live like that.
Okay, so what was going through your mind at that particular point?
I thought it was there. I know I mess up. I mean, I'm very sure that station has 0. But that one I know for a fact.
Oh, okay. So let's say, what did you learn from that OSCE station?
Oh, after that, right now, every woman I see, either around the School of Medicine or around our fraternity, the first thing I'll call that person is a doctor, unless the person actually disclaim it herself. The first title I'll give to the person is a doctor. Since then, even if you're a very young, very small lady, you are a doctor for me, unless you issue a disclaimer for yourself.
So you've developed a PTSD. Okay.
Hey, what a surprise.
Will you want to share your social media handle so that the viewers out there will follow you for more updates?
Follow me. Want to follow me? Come to Tamale Teaching Hospital.
Wait, did I hear you say?
Want to follow me? Come to Tamale Teaching Hospital.
Look at this man.
Have a nice day. Hello.
Hello.
Welcome to Medical Mind.
Thank you for having me.
Please, what's your name?
Petrina. Petrina.
What was the most unexpected or saddest OSCE experience you've ever had in medical school?
Okay, so this happened when we were in our second year, and it was a month station with a simulated patient. So I was supposed to do a bimanual rectal examination, and I started and finished without doing inspection first. So after reporting, the examiner was like, I'd forgotten something, I'd left something out. And then I was wondering what it was. So I was like, I thanked the patient, asked for permission, all of that. Like, so I was just thinking about it, and then he was like, I forgot to inspect. And I was like, shocked, because it didn't even occur to me that I had forgotten to do that. So I was scared and worried that it would affect the rest of my performance. But he wasn't too harsh, so that was helpful.
Okay, so at that point that he told you that you've forgotten something, what was going through your mind?
I was scared because I was thinking that he might just like tell me that because I forgot to do that, he's just going to give me 0 or something. And I still had other stations to do, so I was worried that it will affect my momentum, like going through the rest. But I was scared. I was very, very scared in that moment, like very, very scared.
Okay. So what was it that you learned, or if you are to advise somebody who is going for an OSCE station like that one, what would you tell the person?
Okay, I'll tell the persons to just take their time and not be nervous, because I think nervousness was my issue. I should have been calm and relaxed, and I wasn't. So because of that, I forgot some of the important things I was supposed to do. So just take your time to compose yourself. Remember the things you've learned, because you've learned them, so you know them. So just compose yourself, and then everything will flow well.
Okay, so thank you for joining us today.
Thank you.
Have a nice day.
Thank you so much.
Hello, good morning.
Good morning.
And please, what's your name?
I'm Adnan.
Okay, Adnan. Today the question is simple. You are supposed to share one of your worst or saddest OSCE experience.
Okay, as for OSCE, I have a number of experiences, but I will share this profound one.
Continue.
In level 200, I got to a station where I was supposed to examine the shoulder. So on inspection, the patient had a BCG scar on his deltoid area. Then on inspection, I presented that there was no scar on the shoulder. So after the examination, the examiner asked me to go back and check whether there's a scar or not. And when I checked, there was the BCG scar.
Nani? お前はもう死んでいる。He shot you.
That was it. And he was like, you guys have been just watching a video, so you don't come for skills, and because in your mind you learn only the normal, you don't open your eyes to, examine the abnormal ones. So that was how the
It's
experience
like
was.
when you go to the OSCE station, you just have
Ev-
what you have in your head.
Yes,
So just be
everything is
giving it,
normal. Everything
yeah,
is
everything
normal.
as well. So what was going through your mind at that particular point when he told you go and check?
Yeah, it was, embarrassing. For something that's,
So
conspicuous to evade you, there, like it means you are not really paying attention. So yeah.
Wonderful. Shall never end.
was there anything you learned from that station?
Okay, so from then I have always made it a point that I always try to observe very closely and report any findings I find, instead of taking what I learned, from the books and the videos, to the examination hall. So that's what.
Thank you for joining us today. Have a nice day.
Yeah,
Bye
thank
bye.
you.